Hello, this is Dr. Chandana Galidevara, Senior Consultant Gynecologist, Ankura Hospitals, Madinaguda. I am going to discuss about symptoms and diagnosis of multiple pregnancy, most commonly twin gestation. Now, coming to the symptoms of multiple pregnancy, it can be divided based on the trimesters as first trimester symptoms, second trimester symptoms, and third trimester symptoms. What to expect in first trimester? Generally, the common symptoms like nausea, vomiting are exaggerated. This is because the hormone levels are more in multiple pregnancy. The beta-HCG is produced in excess quantities in a multiple pregnancy, and so the woman can experience excessive vomiting, which we also called as hyperemesis. In addition to it, there is more breathlessness and weakness and fatigue in the first trimester. The second trimester symptoms include excessive fetal movements. A woman starts perceiving fetal movements around 18 weeks of pregnancy. So these movements are exaggerated in a multiple pregnancy because of 2 babies or 3 babies. Also, in second trimester, the nutritional requirements for the pregnant woman is much more compared to a singleton pregnancy. So these women need to consume more calories and also more supplements. The iron and calcium supplementation needs to be double compared to a singleton pregnancy. In the third trimester, the common symptoms are because of the over-distended uterus, the woman can experience lot of mechanical symptoms like aches, pains, musculoskeletal issues, and also she can have excessive breathlessness. Some women develop swelling of feet because of the increased pressure. Some women are also at risk of developing diabetes and hypertension in pregnancy whenever they have multiple gestation. The risk is higher in a multiple pregnancy compared to a singleton pregnancy to have hypertension or anemia or diabetes. It is important to understand that women with multiple pregnancy have a risk of preterm labor or going into labor early because of the over-distended uterus. So the babies may be premature, and this needs to be looked after in the third trimester. Coming to the diagnosis of multiple pregnancy, the diagnosis is essentially based on the first trimester ultrasound. In ultrasound, we see 2 gestational sacs and 2 fetal poles with 2 different heartbeats. That is how we diagnose a twin pregnancy. Sometimes, based on the type of twinning, whether it is a dichorionic diamniotic twinning or monochorionic diamniotic twinning, we can either see 2 separate gestational sacs with 2 separate fetal poles and heartbeats, or it can be a single sac with a membrane separating 2 babies with 2 different heartbeats. Once a twin pregnancy is diagnosed based on ultrasound, the doctor customizes the care for the pregnant women based on what symptoms to anticipate and what kind of nutritional advice to give. Based on the nutritional advice and taking timely help from your doctor, you can have a successful pregnancies with a good outcome for both the babies. Thank you.